Okay. All right. So Ottawa pulled something interesting here. On yesterday, a special statement from Dr. Vera Etches. Today, we are reporting 93 individuals have tested positive for COVID 19, the highest number in a single day since April, tested positive for COVID 19. There's some problems with this first sentence. First of all, one day, 93 individuals testing positive is not an average. It's just it could be a couple of days piled into one. It brought it up. And they're not positive for COVID 19. They're positive for SARS-CoV-2, the virus that can cause the coronavirus disease. So it's the disease when you go into the hospital. But if you're positive with a test, you're tested for SARS-CoV-2. You're not tested for COVID. COVID is the complication of SARS if it develops. So right away, this is incorrect. And for a doctor, this is kind of like really dumbing it down. So it's kind of strange for a doctor to say that. I don't want to confuse people, but they could also, make the distinction between the two. Anyway, moving on. So the overall goal of our response to pandemic is to prevent the levels of COVID-19 transmission, SARS-CoV-2 transmission, in Ottawa from disrupting society detrimentally and to prevent hospitalizations and deaths. Okay, so that is the goal. All right, so this level of the virus in our community is too high for these purposes. The people testing positive for COVID-19 linked to schools and long-term care home is leading a disruption for families and workplaces and the deaths at the time of the long-term care home at this point. And we need to bend the curve down now. So many of the people testing positive are in their 20s and 30s, the age group, and then we are seeing more school-aged children test positive with their exposure in the community. 40% of the people aged 20 to 39 who become ill recent weeks acquired SARS-CoV-2 while in close contact with somebody outside their household. Common examples include indoor social gatherings such as parties, gatherings at cottages, Airbnb, outdoor gatherings where people are close together, all recreational activities. A lot of it is involving economy and, just general, living is all of a sudden a problem. Okay, in light of the increase in the community transmission and in light of the recent situations with the slow adherence to public health guidance, I'm not sure what that means, I am officially invoking a Class Section 22 order under the Health Protections and Promotions Act that stipulates that any person that tests positive for COVID-19 has the signs and symptoms, is a close contact with somebody who has tested positive for COVID-19 and has been tested for COVID-19 and is awaiting test results or otherwise has reasonable grounds to believe they have COVID-19 must self-isolate without delay. These individuals must remain in isolation for 14 days unless COVID-19 is ruled out, and they must do everything they can to avoid exposing other people to COVID-19. Seems rather draconian. It's very broad, and it basically puts you in house arrest because you have to isolate for 14 days, even if you know somebody who's got it. So basically, one person gets it and everybody around them has to self-isolate. That's going to be a problem, boy. That's like, I don't see how that can work. Again, you're affecting the healthy and you're not quarantining the sick. So this is a problem right here. And he goes, failure to comply with this order could result in a fine of up to $5,000 for every day or part of each day which offense occurs or continues. While we have issued individual Section 22 orders previously to facilitate obtaining a list of close contacts, we have not had to take anyone to court. When people understand that we have the authority to collect this information, we protect their privacy when reaching out to the contacts, and we have the support for them to protect the community and have received the information we need because the numbers of people who are working with the has increased so much that the class order will support timely escalation when needed. Details can be found on our website. Class order. So I guess this is a more legal paper here. All persons residing or present in the city of Ottawa who are identified as a person diagnosed with the COVID-19, have the signs and symptoms of COVID-19, have been tested for COVID-19, are awaiting the results of the tests, otherwise have reasonable grounds to believe they have one or more symptoms, or are a close contact to a person identified in A, B, or C. Close contact means you are caring for, living in the same household with somebody, and have otherwise been identified as a close contact for by the medical officer of health, Ottawa Public Health, acting under the direction of the medical health board, and so on. And let's see. So you are to self-isolate without delay according to instructions provided by the Ottawa Public Health. This includes remaining in your home or isolation facility. Isolation facility, do not go outside unless on a private balcony or enclosed yard where you can avoid close contact with others. Another thing that doesn't make sense, you're better off outside, but they don't want you outside because when you're inside, you kind of hotbox yourself. When you're outside, the wind blows and you get the sunlight and vitamin D and everything else. Of course, they don't tell you to take, vitamins and look after yourself because that is a great way to prevent getting sick. But that's never mentioned. So stay inside. Don't go outside unless it's on a balcony. Remain in isolation until the expired 14-day period that begins. And on that day, when you first show your symptoms are tested or are diagnosed, whichever is earliest. Or the last day of close contact unless otherwise instructed by Ottawa Health in accordance with the current Ministry of Health guidelines. The number, the 93 number, saying that is a trigger to engage this is kind of, I don't know, it's not a good idea, okay? So here we go. So the assessment considerations for Ottawa core indicators for COVID-19. So let's see, last update, domain level scores are reviewed. Okay, so they have this color thing. So virus spread and containment. Indicators of COVID-19 community cases, 7-day moving average. That's so less than 5 a day, sustained decrease for 14 days. Yellow is 5 to 10 cases a day or decreased trend for 14 days. Orange, 5 to 10 cases a day or stable trend for 14 days. And red, 10 plus cases a day or increasing trend for 14 days. And percent of COVID-19 community cases who have no known source, increased trend for 14 days. So unknown if it's increasing trend for 14 days. COVID-19 healthcare instructions, outbreaks active, sustained decrease, decreased trend for 14 days, sustained, and then decreasing, stable trend, and then 10 active days or increasing trend for 14 days, increasing trend for 14 days, increasing trend for 14 days, and 19, okay, so the school and childcare establishment outbreaks, COVID-19 hospitalization. Okay, so here we got COVID-19 hospitalization, increasing trend for 14 days. I don't know what this other stuff is here, but community cases that have no known source, healthcare and institutional outbreaks. Okay, that would, I guess, is important enough. And school and child care establishment outbreaks inactive. So really, what seems to be the only thing that's makes any sense is the hospitalization. If that's increasing, that would be something to worry about. The rest of the stuff, just don't get tested. Just stay away from the test, and it won't get into the red, because the way I read this is that the more people get tested, the more likely it's going to go red, and then the more things are going to go upside down. Oh, all right. Okay, the number of COVID-19 tests compared with the recent productivity, Ontario. Okay, so the tests are going up, 40,000 tests, like they're pretty high, and the positives are, so as the tests increase, so do the positives. Okay, so this what ends up happening here is the more you test, the more positives you get, and then you get this increase. If you don't test as much, then this line won't move, because these people they're asymptomatic. They don't even know they got it, and it's not dangerous, right? So severity. So this is the important one here. So confirmed deaths among COVID-19 cases by date is, and here we are. Since June, it's just been straddling. Basically, it's over. Okay, so over here, when it was killing a lot of people, the virus was more dangerous, and then as it peters out, it becomes less dangerous, and people get it, and they don't realize they got it. But if they're testing everybody, then you have a positive test, but you don't have it reflected in the severity. So that's the thing right there. So here you look at cumulative cases as of September 21st. Deaths reported ages 19 and under, 1. From 20 to 30, 11. From 40 to 59, 122. That's 9%. It's 1%. So anybody under 60, only 1% of positive cases end up as a more dead. 1% under 60. Then from 60 to 80, it's 9.4%. And then when it's over 80 is when it becomes 31%. And in ICU, 2.2%. And ever hospitalized is 10%. I'm not sure what that means. But you can see here, if you're under 60, you got a 1% chance of getting sick. That's crazy. All right, let's check out my area here. So I'm in Sudbury. See if I can find it. And there's some things that are not clear about, like, for instance, like they're not measuring the percentage, the averages. They're not measuring the averages. They're measuring the amounts, and that is not correct, because you can manipulate the results. It's not an increasing average. It's an increase in numbers. So you got more cases, more tests by let's say 20% more, and then out of those 20%, you may get a 5% increase. What's happening is it's actually going down 15%, but that's not reflected in the data. So that's why you want to do percentage. So if you divide that and make it out of 100 or 100,000, then you won't get that upswing. So I want to see if they detail that, because so far they mention it. They mention it in the epidemiology reports, but they don't mention it in the stuff like, So let's see what's going on here. So technical notes, data sources. Data sources report are based on information extracted from the Ontario Ministry of Health, and the information is Ontario Population Source, Ministry of Health. Okay, the data represents cases reported to the Public Health Unit and recorded in CCM Plus. As a result, all counts will be subject to varying degrees of underreporting due to a variety of factors such as disease awareness and medical case-seeking behaviors, which may depend on the severity of the illness, clinical practice, changes in laboratory testing and reporting behaviors, lags in the CCM data entry due to the weekend staffing, may result in a lower case count than would otherwise be recorded. And there you go. So when he turns around and Dr. So-and-so, who did this on Monday, said that the highest number was 93, basically it was the weekend tally that she just slammed and declared an emergency. So I'm calling I'm calling foul on that. They just said it right here. So the only cases meeting the confirmed case classifications listed in Ministry of Health COVID-19 case definition are included in report counts from CCM. These includes person with a positive detection of serum plasma, so antibodies of SARS-CoV-2, which has added to the confirmed case definitions on August 16. So they added the serology to the cases. So, The number of tests performed does not reflect the number of specimens or persons tested. More than one test can be performed per specimen or per person, such as a percentage of tests that were positive do not necessarily translate into the number of specimen or persons testing positive. Right. So what it looks like here is that if you test positive for the antibodies, meaning that you've had it and you're now immune and you're perfectly fine, you're going to be counted as a case. So that's another inflation of the numbers. And if you think about it, as the virus or epidemic or pandemic, whatever you want to call it, runs its course, many more people are going to become positive with this serology. That's what you want. You want the population to get this. This is herd immunity. And the more people that have test positive for the antibodies, the better off you are, because it becomes like a break. So you have a certain amount of the population that have the antibodies. It prevents the virus from jumping to that person, and then that person jumping to another person, and it just makes it contains it, and it just prevents it from spreading. The fact that more people have the antibodies, but they're counting it as a positive case, if I'm reading this right, and that's again bogus. So reported date. Let's see. Case episode date on the estimate of the best date, whatever. Let's use resolved. Resolved cases are determined only for COVID-19 cases that have not died, cases that have died, or are considered fatal or not resolved. The following cases are classified as resolved: cases that not reported as recovered, cases that are not hospitalized and are 14 days past their episode date, cases that are currently hospitalized, no hospital tie, and have status closed. Hospitalization include all cases with hospital admissions date were reported. ICU admissions, orientation likely. So okay. Percent. Okay, positivity. Percent of positivity is 1.5%. The total percent of positivity means that 1.5% of tests were performed for COVID-19 were positive for COVID-19 on September 21st, and this is a change of 0 from the previous day. Test completed 34,201, and the number of tests performed on September 21st was 34,201, and a change of extra. Okay, so you see that this is really the number. So 1.5%, and it didn't change. And the outbreaks here, retirement homes. Okay, so I think what's important here is that the percentage of 1.5 is steady as far as Ontario is concerned. Cases in Ontario, deaths. Okay, so you see the important thing here is that these deaths are low. Let's go right into. Okay, so here's 3. Okay, so since July, the highest amount per day has been 3. So it's 1, 2, 3 with a few missing, and you can see it's lowering. It's actually getting lower. Okay, so this is trending down. Okay, let's take a look at Ottawa Public Health. Yeah, it's even better. So look at the death rate in Ottawa. For a long time, there was nothing for a while, and then 1, 1, 1, 1, and then over here, a little cluster over here. Okay, 1, 2, 2, 1, 1, 2. It's really very not, and then cases. But look at the change here. So this is a result of the testing. So this is an upswing, but yet the deaths are staying the same. Here is where I live. There was 2 deaths in where I live, and cases are never got. Okay, right here there's a maximum of 10, so there was 10 in July. Really, not much going on here in Sudbury. So we're all locked down for barely nothing. We never got hit with anything. And then we know that it, now here, graph by count cases, hospitalization. So if you look at hospitalization let's go back to Ottawa, because that's the one that, so again, it's when you get older, it becomes, It's just cases, right? And the rates, hospitalization rates. Right. Okay. Deaths. So yeah. Okay. So you go in the hospital, or again, it's what is this here? Death rate and total deaths. So at when you're 90 years old, you're gonna get it's worse. But for everyone else, this is peanuts. Okay, so this is where I usually go to get my stuff. So we go to Ontario, Ottawa. It's Ontario. See, this is a bit of an outlier here. A lot of cases all of a sudden. Like this just jumps up out of nowhere. That's weird. Okay, here we go. Ottawa. Okay. All right. So let's take a look at this claim here. Okay. Okay. So this was a Monday. Today is 23rd. Okay. So on Monday, on the 21st, we had the weekend's tally, which ended up being 90. But on the Friday was not very much. And on Sunday, no, that's tomorrow. That's today. That's yesterday. Okay, so look, new cases were 8 yesterday, but they were 90 the day before. And so they invoked the special thing, and then, but you look at the cases surrounding it, it didn't change the average. It actually, if anything, it lowered it. So now it's down to 47. Okay, so that's interesting. That's I'm calling more bullshit on this. Fatalities dropping, steady decline on the fatality. That you want to go up. Okay, so really, I don't know. What can I say? Yeah, this is screwed up. All right. Well, anyway, we'll just leave it at that because we got an emergency here and these incredible measures, and it's not right. It's not right. No. So the death rate is actually decreasing, yet we're in orange. And all it takes is to raise that because it says 10 cases a day or increasing trend for 14 days. Doesn't say the percentage. It just says the case. And this is set up for abuse. This is set up to basically, no matter what you do, this can be manipulated. There's nothing solid about this at all. And this is not good. Yeah. Okay. So here we go. So Chief Science Officer for Pfizer says second wave faked on false positives, COVID test, pandemic is over. Exactly what I've been saying. And I'm not I'd like to make this bigger. Okay. So in a stunning development, former Chief Science Officer for a pharmaceutical giant Pfizer says there is no science to suggest a second wave should happen. The big pharma insider asserts the false positive results from inherently unreliable COVID tests are being used to manufacture a second wave based on new cases. Dr. Mike Eden, a former vice president of chief science officer for Pfizer for 16 years, says that half or even almost half of the tests for COVID are false positive. Dr. Eden also argues that the threshold for the herd immunity may be much lower than previously thought, and he may have reached in many countries already. So we are basing our government policy on an economic policy and civil liberties policy based on limiting people to 6 people in the meeting, all based on what may well be completely fake data on his coronavirus. Dr. Yeardon says simply yes. In the interview, given the shape of the important indicators worldwide epidemics such as hospitalizations, ICU utilizations, and death, the pandemic is fundamentally over. He says, were it not for the test data that you get from the TV all the time, you would rightly conclude that this pandemic was over, as nothing much has happened. And of course, the people go on to hospital moving into the autumn flu season, but there's no science to suggest a second wave should happen. In the paper published last month, it was co-authored, How Likely is a Second Wave? And the scientist writes, it has been widely been observed that all heavily infected countries in Europe and several in the U.S. states, likewise, that the shape of the daily deaths versus time curves are similar in the UK. Many of these curves are not just similar, but almost whatever. The data in the UK and Sweden and US and the world can all see that all cases, deaths, were on the rise in March through mid to late April, and then began tapering off in a smooth slope that flattened out around the end of June and continues today. And the case rates, however, based on testing, rise in upswings and up and down widely. Media messages is ramping up expectations of a second wave. Yes, absolutely. So confirmed daily COVID-19 cases and deaths. Daily confirmed cases, same thing. They're just testing, but the date is going down. So this is happening all over the place. And here, what I got here, daily confirmed COVID-19 cases in the United States. They're all over the place, but the U.S. is completely has manipulated. The data is just no good in the U.S. because it's completely spoiled. Because you have, look at this. I mean, you got this jaggly stuff, and then, this is trying to get Trump in trouble here. And so they're just false positives and under whatever reporting, and this is completely bogus. What do we got here? Sweden. Now, Sweden did it right. Okay. So they daily confirmed deaths up and then straight down, and daily confirmed cases not really high. They're like the winners. Sweden did it right. They didn't lock down. And then what do we got here? Cases in the world. Again, the world is yeah, okay. So basically just confirmed what I've been saying.